The spores can last for decades. Decades.
Wow.
We don't actually know how long they last, but we know that they last for at least 15, 16 years so far. So it is a very dangerous disease, and obviously we have it in our forests. We don't know how it's arrived in this country. We do believe that it is a foreign import, simply because of the speed with which it is killing kauri. It is almost 100% mortality rate. So the international pandemic that we've just been through with COVID, the mortality rate for COVID is between 1 and 5%, depending on whether you get hospital treatment or not. 5%. For kauri, it's 100%. Every tree that gets it dies. There's been no resistance found. There has been an entire research project dedicated to trying to find resistant trees, and they have failed. And they found some trees that maybe die a bit more slowly than others, but that's not quite the same as finding resistant trees. So it's an extremely dangerous disease. It's very easy to spread. To some extent, the horses bolted, when it first arrived and started to express itself. MPI's response and the council's was lame, to say the least, and it took a huge campaign to get them to do something more proactive. So that's why I've brought this map to show you a little bit about what happened with the Waitakere Ranges. So you can see that this is the Waitakere Ranges. It's got red and black dots on it. I hope you can see the red and black dots at least. The red dots, this was the Auckland Council survey of 2011, which showed trees or individual or groups of trees that had kauri dieback symptoms and or a positive soil test approved by Tophthora axodicida. So those were the red ones in 2011, and then they repeated the survey 5 years later and found all the black ones now were showing symptoms or positive soil test. So what that shows you really clearly is that once this disease gets into an area, it spreads really easily within that area. Obviously, it'll be spreading from tree to tree, through the root zone, through water, through pest animals, particularly pigs. But what this map also shows you very clearly is the role of the track network. So the survey was done by flying a helicopter on a grid pattern over the entire ranges. So they didn't just walk along the tracks and see infected trees. They surveyed the entire ranges from the air. And they spotted the trees that were starting to die back in the canopy, and then they sent a ground truthing team in to go and look for symptoms on the trees and to take soil samples. And this is the results that they got. And what it showed was really the Hillary Trail, actually. So this is Huria, this is Whatupu, this is Karikari, this is Piha, this is Anawhata, this is Tehenga, and these are the Cascades. So that's the Hillary Trail. And Piha and the Cascades are the two most infected areas, and they're also the areas with the most people. You would easily, on a normal bank holiday weekend, get 20,000 people going to the Cascades, or 10,000 people on a day at Piha. It's very common. And obviously, these areas have a lot of walking tracks. And basically, these walking tracks across the entire ranges, there was 250 kilometres of walking tracks, and they've never been upgraded. They were in such a bad state, basically just muddy tracks over tree roots. And so if you've got a soil-borne pathogen, you're just asking for trouble, really, aren't you? And we have 2 million people a year going walking in the Waitakeres on degraded, muddy tracks, and you've got a soil-borne pathogen with 10,000 spores on a pinhead of soil. You're pretty much doomed, really. And so what the overall, these two surveys 5 years apart showed was that the spread of the disease had increased from an average of 8% to 19% in 5 years, so you were talking about 1 in 5 Kauri being infected and showing symptoms. Goodness knows how many with latent infection that weren't showing symptoms yet. Probably double that, I would have said. And what happened when the council released this report in 2017 was that Te Kawerau Maki, who are the iwi, the mana whenua, said, that's it, enough. Otherwise we are going to lose all the Kauri in the ranges. The scientists reckoned that within 30 years, if nothing had been done, we would have lost all of the Kauri in Piha, and that we would have had extinction of Kauri in the Waitakere ranges within our lifetimes, most definitely, if it was just allowed to carry on. If you had that doubling every 5 years, which obviously if you just carried on, you would have had doubling. So Kawerau went to the council and their community partners, including the Tree Council, which I'm the secretary, Forest of the Bird, Waitakere Range Protection Society, etc., all sat around the table, and Kawerau said, we want to put in a rahui, we want you to close the ranges, and we heard, I don't know how many excuses for months on end from the council. It was impossible to do that, no way, couldn't do it, not possible. And so Kawerau just did it. The rahui ceremony, which was at the Cascades by a tree called Agatha, which is now dead, which was a massive Kauri at the Cascades, was probably the most moving thing I've ever been to in my life. It made me want to well up just thinking about it now, and it's nearly years later. It was unbelievable, and the response that we got from the public was overwhelmingly positive, with universities, businesses, tramping clubs, etc., all saying, fine, we won't go in there, we'll stay out, we'll not go to the ranges, you're doing the right thing. People basically closing down their tourism business, the Part2 Lodge refusing to take bookings from people wanting to walk the Hillary Trail, etc. And still the council refused to close the tracks, still the council dug their heels in and refused to do anything. And it was going towards Christmas, and so basically the community supported Kawerau to do this massive publicity and public campaign to prove that it was possible to close the ranges by using volunteers and kids and folks just sitting on track entrances and talking to people and them turning around and getting in the car and going home. And we did that, and eventually by February the council had a change of heart and decided that we backed them into a corner really, and they decided that they had to close the ranges because there was so much public pressure to support the iwi to do the right thing, and so much media coverage. The media were absolutely unbelievable. We just did endless interviews and endless articles, and it was fantastic. It was the topic of the year. I couldn't go to any barbecues or anything without having to talk about Kauri Rescue the entire time, which was great. I mean, I'd spent 10 years trying to get people interested in this topic, so, finally. But yeah, it was really, really successful, and the council chose to close not only the majority of the tracks in the Waitakere ranges, but also in the Hanuas, where there is no Kauri dieback yet. So it's really important to close that healthy forest, because if you don't have healthy ecosystem, then you're screwed, basically. You've got to protect the healthy ecosystem. That's the most important thing. And obviously reducing the spread from the areas of unhealthy ecosystem, which is what the Waitakere ranges was. So then Kawerau formed a partnership with the council, and all the public were asked whether they would pay an additional dollar or something on their rates for the natural environment targeted rate, so that the upgrades to the track network could be done, so that if a track was open, you would be walking along it with dry feet, and you were not going to be walking on roots and spreading mud and all the rest of it. And Kawerau are basically like the auditors of the track network. A track does not get opened unless they're happy with it now. And I have to say that I think that whole process has moved that conversation about co-governance and co-management forward by, light years really from where it was, and the council actually having to genuinely work in partnership with Mana Whenua over issues that were an existential threat to the forest and to them. So yeah, that was huge, but it really just shows you, and you know, the whole conversation, obviously over the Rahui and Waitaki spilled out into the rest of the country because we've got Kauri in the Coromandel. We have a small amount of infection in Coromandel, but in Northland the situation is absolutely terrible. Trouncing Forest is dead, it is a graveyard. Waipoa is really badly infected. Everyone's got their head in the sands thinking that Tanimahuta doesn't have it yet, but it has infected trees 15 metres outside its root zone, so you know, seriously folks, it is only a matter of time. And the situation would be really bad if it wasn't for a guy called Dr. Ian Horner, who works for Plant and Food Research. And Ian had been working with avocado growers, and they have this Phytophthora cinnamomi that's affected avocado for decades. And they've been using a chemical called phosphite, which is a very basic agricultural fungicide. Been around, it's phosphorus acid and been around for a very long time. The avocado growers use phosphite to control cinnamomi. It doesn't get rid of it completely, but it enables the trees and the disease to coexist, if you like, at a low level, so that the trees can continue to produce fruit. So Ian wondered whether phosphite could be useful with Kauri. And so he started doing some experiments. He got some money from the national programme to do some experiments, and he experimented at Huria, and he also at Pakari and various other places, and he started spraying trees on their bark, spraying them on their leaves, spraying them on their roots. None of that worked. It didn't really get into the trees. So then he decided, oh, let's drill a hole and inject it and see how that goes. So he started doing that, and he used the same dosing that the avocado growers were using, and that was way too much, and he killed a few trees. So he reduced the dose really radically, like massively, down to a very, very low concentration and a very, very low dose. And the trees stayed alive, and didn't get a phytotoxic response. And 10 years later, those trees are still alive. Wow. On one treatment. Wow. Yeah. Now, I knew about this, and when I live in Titirangi, and I'm surrounded by people grieving, literally, over the death of their Kauri in the gardens, because it's one thing this tree invokes, and that's an emotional response in people, wherever you come from. Māori view them as ancestors, and to be honest, so do Pākehā, from the people that I talked to, who they say it's like grandma in the back garden, and you know, when the tree's sick, they're literally grieving and devastated about this. So I really wanted to help these people, and I knew about Ian's project, so I was taking any opportunity that I could to get in front of council officers and say, like, you know, why can't you let people use phosphite, because they've got nothing to lose. These trees are going to die anyway. It's their own private land. Why can't we run a project? No, it's too risky. We can't be killing trees, blah, blah, blah. They're going to die anyway. Whatever. Anyway, Ian heard that from somebody else that was at one of these meetings where I was banging on about it, and got told that that's what I was doing, so he rang me up and said, there's an opportunity to go for some funding from the National Science Challenge. Do you want to put together some kind of project? Yes. So we got together a project team with some really cool people, social scientists, iwi reps, scientists, plant pathogens, and biosecurity experts, and we put together a project and applied to the National Science Challenge, and we were one of only 2 projects that were funded in 2017. So we ran what we called Kauri Rescue for 2 years on that money, and started working with, first of all, just a pilot group of maybe 10 landowners who helped us put together a treatment kit, an instruction manual, and refine it to make it easier for people to understand how to do it, and to develop some health assessment criteria for the trees so that we could treat the trees and then monitor how they responded to the treatment. And we've been doing that now for 5 years. We've worked with over 100 landowners. We've treated about 2,500 trees with them. We've done a huge amount of education. And the project, we're just entering what we're calling phase 4 now, where we're scaling back slightly the monitoring that we're doing in terms of the complexity of it, to make it a lot easier for people to do it more quickly, and so therefore get through more trees. And we anticipate eventually we'll have effectively proven the methodology, and we won't need to do the monitoring anymore, and then we'll move into a new phase which will just be more of a treatment phase. But for now we're still in this citizen science monitoring phase, and we use obviously the landowners themselves. They have to do the work because there's very few of us that can get paid. Auckland Council is funding us at the moment in Auckland. We have a little bit of money from MPI to do outside of Auckland, and the National Science Challenge is still funding us to do some monitoring of the trees that have been treated and some social science research. So we have quite a broad group of funders, but Auckland Council is really paying the guts of the work that we're doing with landowners in Auckland. And we're just about to go and talk to the iwi in Part2, which is on the other side of the Manukau Harbour, where we know that there is a lot of infection and large properties with lots of trees. So we really want to get in there and start helping them. And obviously, if you're a landowner, you've got a large property and you've got a lot of trees, it's a little bit overwhelming, because this is a very labour-intensive project. You've literally got to drill holes and inject these trees, measure their girth, you know, the canopy, take photos, blah, blah, blah. It's a little bit involved. So when people sort of run up against that I can't cope anymore wall, we take along volunteers and run workshop blitzes to help them do more of the work, and keep them enthused and energetic to keep going on the project. And we have some landowners who've literally treated hundreds and hundreds of trees on their property, and they're doing an amazing job. And it sort of has a little snowball effect, one landowner will talk to their neighbour, and yeah, we can start working together. So it is really positive. It is a sort of ray of hope. It is not a cure for Kauri dieback. So using phosphite does not get rid of the disease in the soil. It remains in the soil. That property is infected and will always be infected. You don't ever get rid of Kauri dieback. Ever get rid of it. Unless you completely remove all vegetation and you starve out the pathogen and just have bare soil for like 10 years maybe, then you might be able to get rid of it. But whilst it's got hosts, and we don't actually know what other plants this pathogen hosts in yet, Ian is currently running an alternative hosts research project to try and work that out. But at the moment, we don't know why Kauri is its favourite host. We don't know where it's come from. We don't know what plants it affects, where it's come from. Probably nothing to do with Kauri. Kauri is just our canary in the coal mine for the fact that we have a major problem with forest health, and we have a major problem with a soil pathogen that's completely out of control, and we all need to wake up a little bit to what this means, because it won't be the only soil pathogen that comes through our borders and affects Talma trees, and has potential to completely destroy entire ecosystems as this does. So I think the message that I would leave you with is about hygiene. When you get to these cleaning stations, if you're going to go in the bush, it is not about that magic spray. That magic spray is not a magic spray. It doesn't actually kill those survival spores unless you sit your boots in it overnight and you don't have any soil on your boots. So it is about removing the soil, all of it, every single tiny particle, 10,000 spores on a pinhead of soil. So before you go for a walk anywhere, you clean your shoes under the sink, in the tap in the sink at home, and you scrub them until they're so clean you would lick them. Because if it's not lickable clean, then you could be carrying anything on that soil. So you don't, when you get home, from a walk, you do the same thing, because the last thing you want is dirty boots that have just been chucked in the shed, taken to the Coromandel with goodness knows what on them, and walked through there, because that's exactly what has happened, and that's why we have this. And we don't want that in the Coromandel. And we have no idea whether this pathogen affects any other species. Like, what if it gets into beach? You know? We just don't know what else it affects. So hygiene, hygiene, hygiene. If you've got Kauri on your property, talk to us. Get a health check. We can help you. We can help you keep them alive. It's not necessarily a death sentence if we get them early enough. We can't bring back the dead. And if they've gone too far, it may be too late. But it's always worth trying, because you know, we don't have anything else. There are various research projects going on, obviously trying to find some kind of cure or interrupter in the life cycle of this thing. One of them that's shown quite a lot of promise so far is Monica Gerth's research from Victoria University, and she has been looking at extracts from native plants, working with Manawhenua to collect native plant products and breaking them down into their constituent parts, basically. Extracting those chemicals and compounds, and then using them like a weapon against the pathogen in the various parts of its life cycle. And they found some success with extract from carnuka leaf, which has basically demobilized those swimming spores. So it stopped them swimming. And obviously if they don't swim, then they can't get into a Kauri root. So that could potentially be useful if they can turn it into some kind of treatment tool. It's not anywhere near there yet, and this is still only been done in a petri dish, so you know that's a million miles away from having something that you could use in the bush. But it is showing some promise. And there's a Matarangamari treatment being trialled in the north using a paste that's had something to do with whales, but it's terribly secret, so I can't tell you anything about it. So you know there's lots of research being done. The National Science Challenge had a few $1 million off the government for a 5-year period, which runs out next year. And so the NPI have just launched a National Kauri Dieback Management Plan, which has also been years in the making, which hopefully will unlock funding for more research and more operational work, because it's the stuff going on the ground, it's the education, it's the track upgrade, it's the monitoring, those are the things that, because if you don't know where this disease is, and where it isn't, more importantly, then you can't take the management measures to keep the healthy Kauri healthy and support the unhealthy Kauri and improve the situation. So, yeah.